stigma. Stop the stigma. Stop the stigma. Stop the stigma.
The battle is currently underway in Nun Division, West region of Cameroon, to stop discrimination against people living with cerebral palsy caused by abnormal brain development or damage to the developing brain that affects a person's ability to control their muscles. The Cameroon Baptist Convention Health Services is championing the campaign with the support of its partners and researchers.
We are here to educate you on the condition called cerebral palsy. Stop the stigma. Stop the stigma. Stop the stigma. Stop the stigma. I'm talking about Bless. I'm talking about Commando, not so. Do we love them? Yes, madam. That's why we are saying that we should stop the stigma against them, not so. That people should stop saying bad things about them, not so. And that you have accepted them in your school, not so. And that you love them, not so. Thank you so much. If you love Bless and you love Commando, that is a good thing that God wants, not so. So we will all say we should stop discrimination against them, not so. Can we say stop discrimination? Stop discrimination. Stop discrimination. Stop discrimination. And send them to school. And send them to school. Very good.
Health professionals say cerebral palsy affects each individual differently. Common risk factors include premature birth, lack of oxygen during delivery, infections during pregnancy, and genetic factors. Parents play a key role in cerebral palsy prevention. It's imperative for expectant mothers to receive proper prenatal care.
Cerebral palsy is being defined that it is a persistent brain disorder that affects children in later life, that they will not have, the movement will be difficult. So women who come early to clinic, we have to detect many things. Those who have infection, we need to treat the infection earlier so that the children will not be affected. Those who are hypertensive, as hypertension is a risk factor to cerebral palsy, we try to manage them. We try to have preventive measures in order that they should not arrive at the stage of babies having cerebral palsy. It can do occur when in cases of patients that or clients that do not go for ANC, because sometimes they have it as a result of bed asphyxia. Babies who pass through difficult labor or prolonged labor as a risk factor to babies having cerebral palsy. Those who come that are anemic, they handle the anemia. Those who come that are having infection, especially the group B staphylococcal infection, they are being treated in order that at the end, babies should not have cerebral palsy. As a woman, you know that you are pregnant. You do not wait to come for ANC late. You start immediately as you know that maybe you are already pregnant. It's good to come to the hospital very early, even if it is 1 month. You come, they look at it and see that you don't have a problem. You can go, they can give you a round for 2 months before you come. But rather than coming late when this problem is there that cannot be solved. So early ANC is very, very important, and it plays a vital role in the child, mother and child well-being.
According to pragmatic studies, there exists over 300 children in the Nun Division living with cerebral palsy. The case of Magba and Malantwen, where there are many misconceptions about cerebral palsy, that explains why the survivors and their families are discriminated upon on a daily basis.
I born Kiara. People then, it's still there for them. It then now 4 years and he never yet wake up.
I gave birth to Kira and now she's 4 years old, but she cannot walk. They are saying that she's an evil child. Some said I should take her and drop her by the waterside, and I refused. Some said if I give birth to her follower, she will walk. I did. He came out in the same condition. I now have 2 of them with the same condition, and I know that it's God that has given me. I'm happy because God has given me the heart and the power to care for them.
Begin to hold them. And I want advise people where they get picking them, where they get the condition like me. So as una get them, so may una no check say go run through una.
I want to advise those who have children with cerebral palsy to know that it's God's assignment to us. Know that God cannot give you what you cannot handle. I am a single mother, and if someone is moved to help me, I will be very grateful. I am the only person taking care of them.
If person want help me, I will glad to take, because as I get them, so not only me the struggle for the whole day.
As I be there with that bikini belly, I be born fine. Then, when that pikin be reach 6 months.
When I was pregnant for this baby, I had no issues till birth. After 6 months, this child had fever.
She don't know for one place, just remain.
I took him to Gunso Baptist Hospital. The child was treated there, but after he couldn't crawl as before. I continued to carry him, and the society said I should stop carrying him, that he is an evil child. Others said he is a snake, but I believe that it was God that gave me the child.
I said, okay, God on the show is right for me, for work way don't give me for work. Small time, I don't see now this stand. We don't reach 11 years, 2 weeks.
He finally started crawling when he was 10 years old, and at 11, he could hold things and stand. He later on walked when he was 13. I sent him to school, and other kids were bullying him, so he withdrew. The CBR team from Gunso saw him and asked me to send him back to school, which I did. The bullying stopped, and now he is already in class 6.
Class 6. I want to talk for parents them with the day house. Man will get this speaking person fool say go.
I want to advise those who have children with cerebral palsy to know that it is not witchcraft. They are not evil children or snakes, but God's creature.
For the picking, not try for year man you would, because you go lost. God you give.
Receive the child with thanks and take good care of them.
God, the atuna, the power for take care for we for this picking. The advice where they begin with this picking, so take on should they picking and if you ever put it for different place, and they continue for take care for we.
Much thanks to CBC for accepting us and taking good care of us. And I pray that all the families should bring out their children so that they can be helped.
Hide them for inside house. Now move them, bring them for public so that they go see them, and then they go help una for this picking them.
C'est le 4e enfant. À 8 mois déjà, l'enfant s'assoit déjà.
This is my 4th child. At 8 months, the child should already be sitting. I noticed that he wasn't sitting. When you place him down, his head will tilt, as you can see. Even to this day, he still can't sit. 2 months after the child was born, we noticed convulsions. One side of his body was trembling. We went to the hospital, consulted at the district hospital, but it didn't lead to any improvement. They keep giving us hope at the hospital, saying that the child is still young and that with time things might improve.
Toujours l'espoir à l'hôpital que comme l'enfant est encore petit, avec le temps ça peut donner, et on est là, on vit avec.
Increased awareness can make a significant difference in early intervention and support of affected families. In Magba subdivision, community initiatives have begun to take root.
In Magba subdivision, community initiatives has begun. So far we have organized workshops and seminars to help educate families on cerebral palsy. This will go a long way to enhance knowledge and awareness, which in turn will help in better response to cerebral palsy.
From pragmatic studies, there is a high prevalence of cerebral palsy in Magba subdivision. And despite the high prevalence and the significant impact of cerebral palsy in this region, there is a lack of comprehensive data on the awareness, knowledge, and prevention practices among women of reproductive age. Addressing this gap in knowledge is crucial for the reduction of the incidence as well as improving the quality of life of children with cerebral palsy and their families. Empowering women of reproductive age on their awareness and education on cerebral palsy is not just a necessity, but a moral obligation. We can change the narrative surrounding this condition by coming together as a community, sharing knowledge, and advocating for better healthcare resources.
Early intervention plays a pivotal role in improving the quality of life for persons living with cerebral palsy. Access to physical therapy, family support, and educational resources can make all the difference.
So I understand that knowledge about cerebral palsy does not only encourage early diagnosis and treatment, but again it promotes inclusion and acceptance within our community. So in Baptist Comprehensive High School, Magba, we have incorporated health education on cerebral palsy and disabilities in our curriculum. So early education about cerebral palsy promotes understanding among students and as well teaches us respect and empathy.
We are making sure that we include all the children in our community. We even go out to sensitize parents on inclusion to make sure that those that are disabled in any way, they should feel the same like any other child, maybe in the community or even in school. We are struggling to accommodate all of these children, and our infrastructures have been structured in such a way that these children can take part.
I'm in Form 2. I want to be a medical doctor because I love their work.
I am Mesiri Anadir and I am in Form 2. I want to become a medical doctor because I love the profession. One day I went to the hospital and I saw a doctor was maltreating a patient because the patient didn't have money for her medical bills. And she had a baby in her stomach who later died.
To treat her, to die with her baby on her stomach. I want to be a medical doctor to help the poor and to help the needy.
I want to become a medical doctor so I can help the poor and the needy and those with my condition. I want to tell my friends that they should not cry again because I have faith in God that one day He will help them and provide for them.
Help them and God will provide for them. And that our parents should not keep
their children with cerebral palsy at home because they cannot walk. Please send them to school and know that education is a good thing for the handicapped.
Education is a good thing for handicap. I feel I cannot talk, but the way I go to school, it pleases me. I can talk, I can hear, I can speak, I know everything. But
as I am going to school, I feel excited because I can read and I can write. I can do everything though I cannot write fast. Parents, send your children to school. Handicap is not a barrier and one day, God will make a way for them. Like me, who has the faith that God will do it for me.
Like me, I'm a fake one of a medical doctor in future.
Stop the stigma.
Cerebral palsy is not caused by marital unfaithfulness.
Do not throw children with cerebral palsy in the bush.
A child with cerebral palsy is not a marine spirit.
Cerebral palsy is not caused by a pregnant woman bathing at night.
Do not lock children with cerebral palsy at home.
Cerebral palsy is not caused by witchcraft.
Do not keep children with cerebral palsy by the river.
Cerebral palsy is not caused by a pregnant woman fetching water at night.
Cerebral palsy is not caused by pregnant women crossing road junctions at night.
Stop discrimination.
Cerebral palsy is not a punishment from the gods.
They are unique and have abilities and talent.
Cerebral palsy is not poor children's disease.
A child with cerebral palsy is not a snake.
Send them to school.
Together we can create a future where cerebral palsy is not seen through the lens of limitations, but as an opportunity for empowerment, understanding, and unity. It's time to come together, take action, and foster change that will resonate for generations. The journey towards understanding begins now and starts with each of us.
Join us in creating awareness on cerebral palsy. Together we can make a difference.